I'm Caitlin Burton. I'm the CEO of Zipline Africa. Zipline is a robotics company, and we operate drone delivery networks in 5 public health systems in Africa: Ghana, Rwanda, Kenya, Nigeria, Cote d'Ivoire. I think what excites me the most is we now know that we finally have the technology we need to solve intractable problems like maternal and child mortality. Just to give you a sense of what we're doing here in Rwanda with the government, we've been able to measure a 51% decline in maternal deaths, an 88% reduction in missed opportunities to vaccinate, and a 45% decline in cases of severe malnutrition in children. And so, it's sort of a game-changing scale. And I think one of the most significant public health interventions we've been able to measure in Africa, because of our impact on malnutrition, it's probably one of the most significant economic interventions as well, because the economic impact of all of those children growing up with healthy brain development is unquantifiable. I think this is what technology is supposed to do. It's supposed to cause these really significant leaps in, these leaps forward in impact and cost efficiency, cost effectiveness, efficiency, these sorts of things. And so we're seeing that happen. We're seeing it happen at a national scale here in Rwanda, and we're seeing it happen at a regional scale in Ghana, Kenya, Nigeria, Cote d'Ivoire. Minister Saban gave his speech yesterday, his keynote at the opening ceremony, and he mentioned Zipline as one of the core digital innovations that they have here, and it's because of this seismic impact. I think one of the most exciting things about this is Zipline is now being supported to scale nationwide in our 5 countries, so we can replicate what we've done here. And the regional impacts we've achieved in these other 4 countries, we can replicate that at national scale for a population of almost 400 million people. And so imagine cutting the maternal mortality rate in half, the maternal mortality rate, 0 dose prevalence, and malnutrition rates in half in a country like Nigeria. That would be just like a complete game changer for the future of development. I think the biggest challenge in this space is that governments have, Minister Saban is in the driver's seat here in Rwanda. He has kind of selected the digital health innovations that are going to solve these problems in his country, and he's brought them all together. He's stitched them together so they work interoperably, and it's solving the problems here, clearly. The difficulty of doing that in a much more complex, or a country that has a different governance system, for example, a country with a federal system and then independent states, it's going to be different. It's going to be difficult. And I think donors and institutions aren't necessarily prepared to follow a government's lead in other countries. And so it's hard to tell a difference between a government's pet project or an institution's pilot. It's hard to figure out what you're supposed to back and scale in order to be supporting bilateral interests and like a long-term vision and kind of sustainable roadmap of a country. So I've been hearing a lot about the need to set these roadmaps, these technology roadmaps and strategic roadmaps that governments, institutions, donors all follow. But I think, governments have picked Zipline to scale supply chain services. I don't know where we're going to uncover the next data system that becomes the common data system for collecting or storing data at a facility level or a patient level or a system-wide level, because of all of the pilots that donors have done in the past, right? Like, so many different products were born. Which one of them do governments choose to scale now and make interoperable with the system, with the Zipline and other systems that they have? So I think the challenge ahead is figuring out what tech to scale so that real development gets done instead of all these kind of tests and pilots and conceptions about market shaping that donors have had. I think that's the future here. I think that's what's being enabled in this post-USAID world, is that governments get to decide. Donors and institutions are trying to figure out how to back them. And as that starts to take hold, I think we'll see a whole different level of development, and it will be a lot more permanent and sustainable. Sure, yeah. So I was saying Zipline is a robotics company. We design and manufacture drones, and we use them for last mile delivery at scale in the countries we operate. And so there's Ghana, Rwanda, Kenya, Nigeria, and Cote d'Ivoire use Zipline for last mile delivery. We store their medicines for them, for the governments. So we're doing inventory management and warehousing. We're doing instant last mile delivery on demand. So facilities order what they need when they need it, and we deliver it to them 24 hours a day, all weather. And so your supply chain becomes extremely reliable and responsive. We also deliver to community health workers. And so you no longer need to rely on things like outreaches. You can have community health workers stationed around a country. They can receive orders from Zipline, and they don't even need a facility to offer care at. They don't need a stocking point. They really just need themselves in Zipline, and they're delivering primary care. We actually, this is a model we started in Nigeria. In zero-dose communities, the states have installed community health workers capable of vaccinating. They order vaccines and primary care products from Zipline, things to treat diarrhea, malaria, malnutrition, and we send that on demand. And now these communities, a zero-dose community is not just a place where children aren't vaccinated. It means that they're really not being reached by the health system. And so you now have extremely reliable access to primary care, including vaccines, in places that weren't being reached by the formal health system. In just 1 year in our states in Nigeria, we've reduced zero-dose prevalence by 36% and 42% respectively. So it's a really massive, a massive change, but really low cost, low complexity solution. It's just creating a reliable supply chain. I think about all of the billions of dollars that have been poured into health systems so far, and why are we still where we are in terms of health outcomes? And I think of it like a leaky bucket. We were pouring billions of dollars into a health system where health workers were being trained, capacitated with tablets, data systems were being set up, but medicines weren't there. And so patients didn't trust the system. No matter how much health education and promotion you did, they didn't come in for health care. Health workers were trained, but they didn't have medicines to conduct health care with, and they had low morale or low motivation because they couldn't properly care for their patients. That's a leaky bucket. That's a system that doesn't have a strong foundation to succeed. Once you have Zipline in a system, the reason you measure these post-Zipline effects attributable to Zipline of a 51% decline in maternal deaths, or a 37 percentage point gain in immunization rates, 42% reduction in zero-dose prevalence, is because you've just now got the medicines there to all the patients where they are. It's not rocket science. It's putting a basic ingredient in place that wasn't there before. Zipline has always sold directly to governments, and we have a no corruption policy inside of our company, obviously. And so we have always partnered directly with governments. They've always procured us directly, and they've always paid us. I think that we're competing in an environment where other companies aren't bound by the same values or laws. And so corruption is very prevalent in the private sector, but it's also prevalent in the donor sector. The reason that billions of dollars was spent on aid in Africa and you don't see tons of strong, significant development is because the money doesn't make it to the patient, So yeah, I don't think that that's necessarily the problem to manage around. That's not like the thing to harness on and say we shouldn't invest in governments because there could be corruption. I think that it's more about the companies that achieve the scale, like win the contracts, creating a level playing field for them, and expecting, we need to be able to back visionary governments that are trying to also eradicate corruption. Obviously, that's what you have here in Rwanda. That's why they have come so far, and they have such a united front as a government. People talk a lot about interconnectedness. You need to be able to find a way to be interoperable with other systems. And so, Zipline, for example, our data goes to the government here. It goes right into the National Health Command Center. So we're part of their dashboards. We're part of how they track epidemiological events around the country, how they track referrals, and how they track the standard of care, all sorts of things. I think, I've been in some conversations with private sector where they're talking about becoming interoperable amongst themselves or setting standards amongst themselves so that governments don't have to do it for them, which would be an interesting place to start. The issue with pilotitis, especially in digital health, is that donors kind of funded a lot of the same systems over and over and over again. And they didn't ever, they often funded nonprofits to develop them. They didn't have a business model behind them. And then they didn't want to give them more money because they felt like that was betting on one horse and not market shaping. So you ended up with like a big market of identical products run by companies that don't have any market apart from the donors, and the donors aren't willing to buy from them because they don't want to market, they don't want to, disrupt the market or distort the market, which doesn't make any sense. That's not how economies work. It's not how markets work. And so I think it's, the impact of pilotitis, people think, is that lots of pilots started and nothing was brought to scale. But I think it's also that the economic buyers of services in Africa are donors, and donors don't necessarily understand private markets because they work in a different sector. And so it's not just that things couldn't scale, it's also that they built a lot of inferior products that didn't ever have to compete for government's business. They were competing for donors' business. This is a system that is well known. It's like what happened to defense and space in America. There was like a small kind of cartel of businesses that won all of that work, and they worked on a cost plus fixed fee basis. So the government just kept paying for cost overruns. They never really developed a product, and we couldn't get to space, and the minute that you turn it into a competitive process and you start buying product off the shelf from a private sector that has developed products for customers and that they've had to compete for those customers, those products tend to be better because they've been built for a market that they have to compete in for business. So the pilotitis is not itself the problem, that we pilot things and don't scale them. It's also that we keep developing bespoke systems and paying charities to do it. That's never going to yield a very good, high-quality commercial product that survives in the world. So I think that this shift to the private sector is an important shift toward competition and quality and competitiveness. That's how private markets work. It's big news that we're scaling nationwide in these 5 countries. Zipline was adopted by the governments, and the governments need to now look around in this changed aid landscape and figure out what to bet on. And because of the massive kind of unprecedented magnitude of our impact and the simplicity of the system, it's just very low complexity. There's no administrative complexity. There's no cash sloshing around in the system. There's no millions of legs of the system to control. It's just a very simple, uniform system. It's easy to manage, and it's extremely impactful. And so I think when you find innovations like this and then you decide to scale them nationwide, you'll be able to see these big seismic shifts without having to calculate how to align and integrate and stitch together and then administratively manage 1,000 different interventions and like tens of thousands of health workers all moving around doing things differently. Technology should significantly simplify that process and at the same time cause better results. So I think that's what Zipline is doing. I'm looking for other examples in the data sector and the digitization sector that's going to cause that, and I think it's going to be a new day.